Today's session is the best opportunity to learn about treatment of chronic subdural hematoma, which has become in the last few years a hot topic in the neurointerventional radiology field. This is probably because subdural hematoma is quite common because of aging of the population. Also, the procedure itself, it's safe and relatively simple and is feasible also for patients unfit for surgery and that have to go back to anticoagulants as soon as possible. During this session, we will talk about anatomy, about the last trial on the subject, as well as materials that you could use to embolize the MMA, and of course, tips and tricks to manage complications. This is a perfect session for people that want to implement this procedure in their center, as well as for people that are already doing the treatment, but they want to check their modus operandi.
In today's session, we're going to review the treatment options open to us when treating patients with aorto-iliac occlusive disease. We're going to consider the surgical options and also the increasing role and increasing scope of endovascular options. We've been doing this for a long time, but frequently find ourselves frustrated or disappointed with the outcomes we can offer our patients or the technical barriers that we encounter. And there's some really exciting new options available. So we can put these in context. We can give you some technical tips. I'll be talking about intravascular lithotripsy, discussing the role of this in vessel preparation for aorto-iliac disease, and introducing how we've introduced it into our center and the outcomes that we're now achieving. 50% of the time of this session is given over to panel discussion and audience questions, so I think it's the perfect format to refresh your knowledge of aorto-iliac disease.
In today's session about aorto-iliac disease, I will focus on the treatment of iliac lesion with covered and uncovered stent. So the participant will have the opportunity to have a balanced, critical overview on what is the evidence and the gaps in it. While some studies suggest the use of covered stent in some scenario, we don't have yet a real evidence. So I will try to help physicians with my lecture to navigate this great area, focusing mainly on patient-specific and lesion-specific decision-making.
So in the today's session, focused on PA, a lot of experts will talk about different things, about referral of patients, selection of patients, about the technical point of view, which embolic agent we have to use and the different outcomes available and in terms of evidence. And personally, I will focus on the role of liquids and especially the role of glue. The main advantages of using glue for PA are very interesting. It's visible. You do both distal and proximal embolization. The endpoint is very clear. And what we are looking for is the long-term results, because potentially we can expect better clinical outcomes in terms of recurrence of symptoms compared to particles, because we don't have any recognition of the main prostatic artery. So glue is potentially the next gold standard for PA compared to particles, and we'll see all these advantages in the session.
So this year's at CIRSE 2025, Boston Scientific is super excited about our program. We'll have two symposiums, one dedicated to vascular with a full portfolio from seeing with imaging, preparing the lesions, and then having the best treatments options for each of your patients. A second symposium focusing on interventional oncology, both with cryo as well as with TerraSphere, where we have huge data sets as well available. And then what else? We have the hands-on session where you can experience the innovations with your own hands. And then last but not least, we'll also have the Emerge breakfast meeting, which is really intended to advance women in interventional radiology. And that's taking place today. So really excited and something I'm super passionate about.